Hello, today we'll deal with smoking, and this is very important when we are discussing COPD. As we know, smoking is one of the most common causes of COPD. Let's look at some statistics. How many people do you think die from smoking in the world? So the whole population, if you take the whole population, how many people die from smoking? 1 out of 5. So 20% of people die from smoking. We could cut all death by stopping smoking. Okay, so it's very, very important topic here. And the lung cancer patients that we see, 90% of them are smoking. Okay, so this is a huge, huge fact. Okay, so please stop smoking. You don't want to get lung cancer. You don't want to get COPD. You don't want to die. You don't want to be one of those 1 out of 5 that are dying just because of smoking. Risk factors. Which are the most common risk factor for COPD? This is a simple question. We already answered it. Smoking. So please, we are now destroying the lung from all angles. We are getting COPD, we are getting lung cancer. The artery system, the cardiovascular system are all getting destroyed, okay? So the percent of COPD patients that are smoking are actually 80%. So we see that lung cancer patients, 90%, COPD, 80%. It's huge. I mean, just think about it. If you go to the hospital and you look at the lung cancer patient and you look at the COPD patients, you can pinpoint 9 out of 10 people and say that these are smoking, or the same 8 out of 10 people who have COPD are smoking. So it's a huge fact. Please let this sink in. How do you calculate pack years? Why is pack years important? We'll see that. Packs of cigarettes. So 1 pack of cigarettes is about 20 cigarettes per day. And you take that times how many years this patient is actually smoking. So it means that if the patient says, yeah, I was smoking 1 pack per day for 10 years, then I know that this patient has 10 pack years. If he says that I have been smoking only a half pack per day for 10 years, then it's 5 pack years. It's not 10 pack years, okay? So it's half because he only smoked then a half pack and so on. So it's very important because in dealing with statistics again, 15 pack years, that means a patient smokes 1 pack per day, so 20 cigarettes per day for 15 years, then he is very, very, very likely to get COPD. It's almost evident that he will get COPD. When we're talking about 40 pack years, that means 40 years with this amount, then it's like there's no rescue. 99%. Of course, there will be one guy or one old lady that you always hear that she's 90 years of age and she has been smoking for 50, 60 years and she have no problem. Okay, there exists this 1%, and it all depends on your genetic makeup, genetics and environment, these together. And of course, if you're so lucky that you're this 1%, then you're lucky. Okay, that's it. You have good genes. Thank God, okay? But otherwise, if you're as most of the people, you will get lung cancer or COPD. So if you look at this picture there, if you would take 40 pack years, if you would calculate how many it is, like 20 cigarettes per day times 365 days a year, and then times 40, you would be completely blown away about how much smoking that is, how much destruction you have in your lungs. 80% of COPD, we said, are smoking. What is the rest? This 20% is environment, occupation, fumes, organic dust, and so on. So environment, is a lot of pollution out there. So of course, it's not only smoking, but there's also occupation. It depends where you work, and fumes that you see, a lot of fumes from cars and so on, and organic and inorganic dust. All depends where you work and what you're confronted with. Risk with smoking. So we said lung cancer, smoking, lung cancer and COPD, but there are also other things that we can consider: difficulty breathing while exercising or having sexual intercourse. This can be, for example, a guy who is going to the gym and he recognizes that he's producing less and less amount of work each week or each month or each year. He's actually destroying his body with his smoking. Death of the fetus during pregnancy, this is very serious, so please, pregnant women should not smoke, but I think everybody knows this. Impotence means that guys, not only that they cannot breathe enough, because we said difficulty breathing while having sex, it's not working anymore. They are impotent, okay? It's not standing up anymore. So for guys, this would be a complete social and psychological destruction, I would say. So for women, it would be a destruction if the fetus, so if the child gets any diseases because of smoking. So it's both genders are affected when we're dealing with this. Infertility would be the most serious one. That means if you're a guy and you want to have a child, and then because of smoking you are not fertile, so you cannot produce anymore, that would be tragic, I would say. So please, impotence, difficulty breathing, infertility, serious things. And of course, then we have heart attacks and strokes. So cardiovascular system is also affected, not only the lungs. So lung cancer, COPD, heart attacks, and stroke. And this is, of course, death. Okay, it's nothing fancy. This is death. So the risk are also cancers. As we said lung cancer. 90% of lung cancers are smoking. Then we have many people don't know it, but we have oral cavity cancer also. It means a cancer starts to grow in your mouth. It's very ugly, it's very destructive, and it's very hard to operate. You will surely die from this. You will aspirate your own blood. You will get your own blood into your lungs if you have an oral cavity. Of course, esophagus is then the tube going down to your stomach. Then we have pancreas cancer. Then we have bladder cancer and cervix cancer, and actually some more cancers, but these are the most common ones. COPD, of course, we said, and it's harming the family members and friends of yours, because you think that you are smoking, the family members are not, and they will not get any cancer. You are wrong. Your family members will also get cancer. Please consider this. If you don't care about yourself, then please care about others at least. Expensive, yeah, expensive. This is up to you. I would say it's pretty expensive. You can invest this in something else. Bad smell. You will smell bad. The taste of food will be bad, and so on. Aging will be quicker. So for women, this is a crucial point. For men, it's more impotence and infertility. For women, it's more that the skin is getting uglier and uglier. Yeah, a lot of wrinkles. So difficult breathing while exercising. As I said, I want you just to give you some pictures to remember this. Then we have death of the fetus during pregnancy. This picture shows pretty clear what this does to it. It's a toxic environment for this fetus, and the fetus will get a lot of problems. It can die also. Impotence, very good picture showing that it doesn't work. Infertility, yeah. You need to go to the sperm bank and give some sperm and check that if it's good or not, and you will see that the sperm quality will be affected, and you will not be able to get a child. And your wife will then simply say that, yeah, then what do? We go to a sperm bank and get some other sperm, or what do we do now? Or the wife will leave you. It all depends on the social circumstances, but this is a huge problem if a woman really wants a child and the man cannot give that to her, and all because of a smoking habit. Okay, heart attacks, strokes, this is pretty clear. You will die. Okay, there's no question about it. You get the heart attack, you get the stroke, many, most of the people will die from this. Cancer, as we said, here are a lot of nasty pictures of lung cancer. And if you look at the middle one up there, this is actually your mouth. Okay, this is a mouth. Look at the teeth there, and then you have a cancer growing in your mouth. Okay, then you have esophagus to the right and pancreas to the left down there, and the bladder cancer and the cervix cancer, all affected. Okay, COPD, this is simple. This is what we're talking about today. Harm family members, as we said. this guy is smoking in his car and think that his daughter will not get sick. Of course she will. She will get asthma and COPD and all other stuff that you also will get, but she cannot do anything about it. Okay, expensive, yeah, it costs pretty much. Okay, bad smell, bad taste. I want to just picture that food doesn't taste anymore so good anymore as it used to, and that's pretty sad. I mean, you are living a long life and you want to taste good food, you want to enjoy your life, you want to smell good, and so on. And these are all things that you will not be able to do. Aging quickly, as you see, this is a typical picture of woman getting a little bit depressed, I would say. You look at the mirror and you get more and more and more wrinkles as you age, and you age more quickly. Treatment, what do we do now? Is it better to stop stepwise? Many people say we can stop stepwise or all at once. Actually, you can do both, but all at once is the preferred one. Okay, stop immediately. Why? Because if you try to step it down, the thing is that let's say you smoke 20 this week, then you say 19 next week, then 18 in the third week, and so on, one by one. You reduce it by one each week. The bad thing is that you're still smoking and the habit is there. You're not stopping the habit itself. The most important here is to stop the habit. This pattern that you have in your life as a lifestyle is continuing for many weeks, and therefore you will relapse very easily, because next week you should, let's say, smoke 18, but you say, okay, today I will smoke 19, whatever. Tomorrow I will smoke then 18 as I should. And then it goes on, and then you're back to 20 or back to more than that. Okay, this is the problem with it. So please stop immediately, remove it, destroy it, don't buy it. Whatever you can, stop it. Please tell your friends, tell your family members that they need to help you with this. Assist, go to psychologists, talk to people. Please read books and so on. Okay. How do we battle peer pressure? Because this is a huge problem, actually, especially by teenagers. You have then a group pressure from your friends, because all of them are, let's say, smoking. And we need to switch the image that we have from a hero to a big fat loser, okay? Because those who are smoking are losers in that sense that they cannot control their habits. They are weak against their own habits. I know that smoking is very addictive and so on, but if you are strong, if you really are strong, you really want this bad enough, then you will stop it. And then you are a hero in my eyes. You are not a hero if you give in to your bad habits, if you give in to your addiction, because this is a real addiction, okay? Then you are weak, okay? And we need to switch this image that heroes are smoking. No, heroes are not smoking, okay? When do nicotine withdrawal symptoms peak? So, well, let's say we stop smoking now. What do you think? How much does it take until we get a lot of symptoms and we really want this smoking again? First 3 days. The first 3 days are the most difficult one, okay? If you manage somehow to go over these 3 days, it will be easier and easier. But these 3 days are the peak of it. So this is a real picture showing that this guy is, let's say, in the second, third day, and he cannot handle it anymore. He stops himself, but he really needs it, and so on, and maybe he gives in. And how many cigarettes do you think is enough to get a relapse? Let's say we stopped 2 days, so we didn't smoke 3 days. How many do we need to smoke to get back to the same habit? 1. And this is very addictive. It's enough if you do it once more. You say, yeah, but let's do it in the morning now, just with the coffee, because I get used to it. If you do that, you can be sure that during this day you will smoke another. You will relapse, okay? When do almost all relapses occur? During the first 3 months. So if you get past these 3 days, and then you somehow get past these 3 months, then you are in a very good position to stop smoking, okay? So first 3 months is the most critical ones. And let's see which are the symptoms. Why is it so hard to stop smoking? Because appetite will increase. That means you will eat a lot. That means that the weight gain will be seen. And then you look at the weight and you see, oh, I'm going up. And I've read that if you're smoking, you increase in weight. Yeah, because you're eating a lot now. Okay, so now you're eating a lot because you want to compensate this addiction. Somehow, when you have an addiction, you need to change it with something else. You need to compensate it with something else. And if the first thing that people do is that they start to eat a lot. And then when they eat a lot, they get overweight. And then they get scared that, wow, I don't want to be obese, so let's start to smoke again. Because when I was smoking, I was fit, I was skinnier, and now I'm getting a lot of weight. How do we deal with that? I know it's so trivial what I'm saying now, but physical activity and healthy diet. It's everybody knows this, but this is the only way to do it, okay? Physical activity and diet. And this is also habit, and I know that this is also hard. And these are my heroes in my eyes, who can have a healthy diet, who can do physical exercise, and those who stop smoking. These are my heroes, okay? Mood disturbances. This is the most dangerous one, because if you stop smoking, then you have complete mood disturbance. You are happy and then you are sad, then you're crying and so on. And this is especially true for women, I would say, because this will affect the complete hormonal system of people. And the negative mood and depression that we will get here is also a thing that needs to be compensated, and then you start to eat more, and then you start to do or you start to relapse, you start to smoke again. So how can we prevent this? Frequent follow-up visits with the doctor, okay? Frequent follow-up. Please, as a doctor, never let this patient alone. Please watch him, watch the patient, talk to him, give frequent follow-up visits. Psychologists, please talk with some psychologists that are specialized, for example, in smoking cessation. These are very important. You are not sick in your mind. You don't need to go to psychologists only when you have big problems. Psychologists are a very specialized group of people who can deal with the psyche, so the psychology of people, and please go to them. It's not taboo. It's not any bad thing. You don't need to tell it to your friends if you think that they will look at you differently. Psychologists are very good for all people, I would say. Regular go and then speak with them, and you will feel better, okay? Now, insomnia. Yeah, you will sleep a little bit less during this time because you are so stressed out that you are smoking, that you are not smoking, and that you want smoking, and then you cannot sleep so much. And this is a cycle that is so hard to overcome now, because you increase your appetite, your weight gain, your mood is completely bad, and then you don't sleep anymore, then you're tired, then you get irritability. So when you work, you start to be irritated, anxiety, you have a lot of anxiety, you have concentrating difficulties, and restlessness. Okay, and now what is the conclusion of a person now? Let's smoke again, because then I wipe all these things out, what I said until now, all the things that I have laid out here. Let's smoke again. No, please don't do that. As I said, first 3 days will be the worst. You will feel this, but if you know that you will feel this, if you are prepared, and then you somehow go over this 3-month period, then the chances are very good that you will succeed. And if you succeed, then the symptoms will disappear, because the body adapts. Okay, you will be completely amazed that you don't have to smoke anymore, and you don't have any symptoms anymore. And that's the goal of what we try to strive for. How do we deal with the strong withdrawal symptoms? Increase the medical treatment dose. We will give medications that I will talk about now, which are patches and so on, and we need to increase this, all depending on the dose of all depending on the symptoms. So if a person are very low symptoms, they have no complaints, then low doses, and the opposite. If they have a lot of symptoms, then please give a little bit more nicotine, okay, in flaster form and so on. We'll look at that soon. Which books are recommended? Why do you need to read about this? It's because it will help. Read about habits, read about addictions, and read about smoking. It's very important that your mind gets prepared, and gets prepared about all the symptoms, gets prepared how to change habits, and then if the mind is prepared, it's much more easier because you have a primitive brain and you have a cortex, a new brain that you have. The primitive brain wants sex, food, addictive things, and your smarter brain, your cortex, can then somehow inhibit this primitive brain. It can stop all these addictive patterns if the cortex, if the brain that is reading and that is logical can somehow shut this primitive brain up, okay? That's the purpose of reading a lot of books. So habits, please read about habits, read about addictions. There are a lot of good books. Read about smoking, okay? Now, why is it important to tell patients that persistence is the most important? Because 3 out of 4 is not successful within 3 months. Okay, within 3 months, 3 out of 4. So 75% will not keep it up. 1 out of 3 will relapse within 1 year. So it means please remain within this 25% or within this other percent, okay? Try to have persistence because you will manage it if you are persistent enough. If you manage the 3 months and then if you manage the 1 year. If you manage 3 months, then actually you have 1 out of 3% chance that you will relapse. So that you're not finished yet. Just because you manage to stop smoking for 3 months, it's not finished. Keep on and do it 1 more year, okay? Treatment. Now we will look at the medication that I talked about. We will have 5 steps here. We have the 5 A's. Ask, advise, assess, assist, and arrange. Ask, advise, assess, assist, and arrange. Let's look at it one by one. Ask. What do we ask? We will ask all the questions that are related to smoking. All the habits. At which time? During meal or during coffee time, when do you smoke? How much do you smoke? How many packs? How many years have you done it? What is the purpose of smoking? Why do you feel it's so important? And so on and so on. Do you have family members? Do you have kids? Do you have other family members smoking? Do you have friends who are smoking? How is it with group pressure? Do you smoke really that you want it, or do you smoke because your friends want it, or do you want to stop smoking at all? And so on. You ask a lot of questions. Please let the patient talk about all this so you have a big picture. Advice. What do you do now? Now you have asked it, then you advise, please stop smoking. What I'm doing in this presentation, you talk about all the risk that is there, about the medication options and so on. You advise the patient and you do it at least 5 minutes at each doctor office. Assess. Assess. What do we assess? We assess the patient's willingness, okay? And we assist. How do we assist? We assist with giving the medication and we do the follow-up and so on. So we assist with the medication. We talk about what type of medication exists, what doses we can use, and what is perfect for this patient because every patient is different. Arrange. What do we arrange? We arrange follow-up visits. Okay, that's very important because if you leave a patient alone, as we said, in 1 year, one third of the patient will relapse, and then you need to start all over again. And which are the 5 steps for stopping smoking? We have these that I show you, ask, as you saw, and all this. What I want to say is that if you remember all these 5 steps, then we can go on and make them one by one. Ask. You ask, as I said, frequency, product use, degree of nicotine dependency. So let's say frequency, product used. We have degree of nicotine dependency. That means you ask the patient, how much do you really want this smoking? Are you only smoking when you're partying a lot, or do you really have a real addiction? Meaning you can, for example, you cannot sit in your car for longer than, I don't know, half an hour until you really need to smoke. So it depends. You need to assess this degree of nicotine dependence. History of quit attempts. You ask, did you try to quit previously or not? If he did that, then it's a very good sign because the willingness is there. Okay. So the degree of nicotine dependencies, you can assess this by asking the age of smoking initiation. If it's earlier, then it's actually much more harder to actually stop. So age of smoking is very important. Okay, Frequency, of course, the more you smoke, the harder it will get. Smoking within the first 30 minutes of wakening is a sign of a real high degree of dependency. It means you wake up and you really need to smoke quickly within half an hour. You cannot wait 1 hour or 2 hours. Then the dependency is really high. Family and friends are smoking also. This is also, of course, very hard. I mean, if you see 2 or 3 people around you that are smoking, how could you possibly stop them? Then you would be the outlier. You would be that person who is this loser in their mind, but actually you would be the hero in my eyes. Okay. So the advice, what does advice stand for? That is this brief advice to quit, and you have it 5 minutes each day, each visit. Okay. 5 minutes, more than enough, but please advise the patient. Assess readiness to quit smoking, and we can divide this into further 5 stages. The assess standing for we are not ready, we are considering it, or we are actively planning it, we want to take action, and we want to maintain it. So, not ready. These are people who you cannot convince simply. They are not ready yet. They can be ready in a couple of more talk with the doctor, but at the point they are not ready yet. Considering, these are people that actually smoke a lot, but they're considering doing it, but they are not really in that phase that they want to actively start to doing it. Actively planning, this is like, yeah, next week we're starting to stop. I will stop the smoking, or today or tomorrow I will do. These are people who really have decided that now I do it. Okay. Action are those people who are not planning, they just do. Okay. They went through these phases and they are at the point that let's kill this shit. Okay. And maintenance are those people who have taken action, plus they say no. When you're partying with your friends, you say, no, I'm not smoking. I'm not a smoker. Or you say, I'm not a smoker. You're not saying I'm not smoking at the moment. You say, I'm not a smoker. Bam. That's it. You don't need to say anything more. And then they ask you, why not? Well, you did it before. No, but I'm not smoker anymore. So please stop that, okay? Respect that, okay? If you say like that, trust me, they will respect you. They will not ridicule you. If you're strong enough, you're really the hero here. You're saying, no, I'm not a smoker anymore. I don't want that shit. Okay? They will respect you, trust me, because deep inside, they also know that they also want to stop. Okay? So, ASSIST stands for medical therapy, behavioral counseling, and this quit date that people are, that you give a quit date with the patient. You sit down with the patient and then you write down at 20th of January, I will quit smoking and so on. Environmental optimization, you optimize your environment so that you don't smoke. You don't buy cigarettes. You tell all your family friends that you're not smoking anymore. You tell them to not give you anymore and not... You understand, the environment needs to be optimal, okay? And you have to work on that so it's better and better. So medical therapy, what do? We have a nicotine replacement therapies. And why is this important? Because we can reduce the symptoms that we talked about, all this weight gain. We can reduce all the symptoms because then it will be easier. And why should we not? Don't stop smoking and please consider medical treatments also. So don't just stop smoking alone. Please take advice from psychologists. Please take medications from doctors. It's not dangerous. You will get nicotine, and then you can slowly but surely reduce this. Patch is something that is very convenient. People don't see it so easily. You have it under your clothes, and you will get some nicotine there. Okay, and you will use this patch for every 24 hours. Okay, the patch dose that we can give is low in the beginning, but in very severe cases, we will use a high dose of more than 20 milligram per patch. Okay, so that's very important that if you have severe symptoms, if you have severe dependency, give the higher doses then. What is important when you apply the patch to the skin? It should be clean, dry, and hairless. Okay, clean, dry, and hairless. Then it will work the best on your skin. The most common side effect of these patches, everything have patches, The most common side effect is like nothing. It's like skin irritation, okay? A little bit skin irritation that you rotate the patch a little bit to different sides each day. You put it in different sides, and then it's done. It's nothing compared to smoking, okay? Please, a little bit itching, a little bit redness, and that's it, okay? And then you rotate it. Lozenges. Lozenges, yeah, this is an oral tablet instead if you don't want to use patches. Okay, and the dose here is 2 to 4 milligram, not 20 and so on. So 2 to 4 milligram lozenges. And you take lozenges until it dissolves in your mouth, okay? And it should really dissolve, okay? So please wait until, do not swallow it. So suck it until it dissolves. How often should a lozenge be used? Maximum once every hour. That's the maximum dose during the first few weeks, and then you start to decrease this dose. So once per hour maximum. Gum. Then we have a gum. This is also a good alternative to patches. Very convenient. You take some gums when you have this urge to smoke. And 2 to 4 milligram is also here. So 2 to 4 milligram gum. The common mistake by gum use is that you chew so vigorously. You chew it, instead of chewing it and then parking it here between the cheek and your gums. And then you leave it there. And then this substance will absorb into your bloodstream. So please park it there. So don't chew it like a dog. Chew it a little bit and then park it there, okay? The nicotine gum should be chewed and parked for about 20 minutes. So not 5 minutes. 20 minutes, and then all doses will absorb. It can be used, as we said, maximum every hour. I just repeated it here to just emphasize that it's the same for the gum here. Okay, once every hour maximum. Nicotine is released from the gum, and then you will feel a hot, peppery taste. Remember this, and this is not dangerous. It's how it's supposed to be. And then it's actually working. Then you know you are getting this medication into your bloodstream. Nasal sprays. Nasal sprays is also a typical non-patchy thing. You will not get itch and so on, but you need to spray something in your nose, and it can be a little bit inconvenient for some. And people will ask you what you are doing. Okay, so for some people, gum is more convenient, or lozenges and so on, or this patch that is not really visible. The most rapid one, though, this is the advantage of nasal spray, is the effect, okay? So you will feel this urge of smoking, and then you take some spray, bam, it will be totally over, this urge to smoke, and that is the advantage of this nasal spray. The side effects of nicotine spray is that you have irritation here and unpleasant taste and smell. So that's something you need to consider. Okay, so just to let you know, this picture shows you that this is the disadvantage of nasal spray. But advantage is, if you're really dependent on smoking, you will get a quick response. How often should the nasal spray be used? More than 8 times a day, and maximum 40 per day, okay? So please, more than 8, but maximum 40 per day. Remember this, because there's a limit toxicity of all medications, and this is the limit of that. The important to consider when nasal spray is that you spray in each nostril once, okay? Once in the right, once in the left, not 10 times in the right, 10 times in the left, okay? And because if you have this urge, it's enough of one. And don't sniff or inhale while spraying. So don't do that when you spray. Just spray it, okay? And don't blow. So don't do that. And don't blow the nose within 3 minutes of the spraying, okay? So wait a little bit, because the effect of the medication needs to take place. The inhalers one, here you see this is completely different. This is like smoking, actually. And some people like this because it's a feeling of smoking, okay? And so it's similar to smoking. And therefore, actually, when those people who are having this habit of smoking with a coffee and so on, if they could actually take this inhaler and they would feel almost the same psychological feeling as with smoking, okay? How often should this inhaler be used? Every second hour. So not every hour, every second hour, and gradually decreasing it over 12 weeks. So 1 in every 2 hours, okay? So these are the things that we have: patches, gums, lozenges, sprays, and this inhaler, okay? For how long should the medical treatment be given? So how long? We said 3 months, because that's the critical point. but some patients need more. So up to 18 months, up to 1.5 years, depending on the patient. After 3 months, I would say stop these medications and try it out without those. And if it works, then you're fine. If it's not, if you relapse or anything, continue with the medication again, okay? Up to 18 months. And then we need to consider some other stuff. Why should a combination medical treatment be used? Because the nicotine patch, together with the oral product, is actually the best one. Because you give a steady level with a nicotine patch. It gives you 24 hours, the steady doses. And the oral products gives you this rapid relief, like nasal spray. When you have that urge, then you give it rapidly. And the combination of this is the most effective. Plus psychology. So as psychologists, you talk with psychologists, plus you do this combination, that's the most effective one, okay? So please consider this. Don't you rely on one thing, rely on all the things. And reading books and so on, all the things that I talked about. As this, we had the behavior medical therapy, we talked about behavior counseling, then we have quit date and environmental optimization. Behavior counseling, this is simply psychologist. Quit date, yeah, you have a quit date and you have to talk with the doctor, and then you really need to stick to it, and you have a follow-up with it, so follow-up control. Environmental optimization, you talk with your family members, that we have already talked about all this. Arrange, what does arrange stand for? That's the last A, that is the follow-up visit. And this is 1 week after the quit date with frequent treatment optimization. The doctor needs to optimize the treatment accordingly. So 1 week after the quit date. And the follow-up visit should be done first in the beginning every week. So every week he schedules it, and then every 3 months, and then every year for many years. So don't think that you stop this. You do it every year. The doctor needs to control that you're not smoking. Quick summary. Now let's go through this presentation very quickly. Just the important things. Statistics. 1 out of 5 die from smoking. Then we have lung cancer patients. 1 out of 9 people smoke. Risk factors. Most important risk factor for COPD. 80% are due to smoking. The pack years that you calculate is you take the pack per day times how many years you have been smoking. And then you get the pack years, more than 15 pack years, then you get COPD for sure. 40 pack years, then you get COPD almost 100%. The 20% are environment, so not smoking, but environment, occupation, fumes, organic and inorganic dust. The risks with smoking are difficulty exercising or difficulty having sexual intercourse, the death of the fetus during pregnancy, impotence, infertility, heart attacks and strokes, cancers like lung, oral cavity, esophagus, pancreas, bladder, cervix cancer. COPD is the risk of smoking. Harm the family members of yours and your friends. It's very expensive. It smells bad. It tastes. The food will taste bad. Aging will be more quicker. And the treatment we do is that we stop immediately. We will battle the peer pressure by changing the image from a hero to a loser. We will always keep it in mind that the 3 days are the most difficult one, and please go have the persistence to overcome that. Please don't smoke 1 cigarette, because then you will relapse. The first 3 months is the period where you have taken these medications and you stop the medication after 3 months. And if you have done your 3 months, then you can congratulate yourself, and you're a good way to actually succeed. But 1/3 of the patients, as we said, will relapse within 1 year. So you need to continue. The nicotine withdrawal symptoms that you will feel, and this is the important thing, because that is the reason why it's so hard. You have increased appetite, you have weight gain, you have then you need to have a new habit now by eating healthy, and you need to now exercise more, and that is also hard for people to keep up. Mood disturbances are very hard. You have a lot of follow-up visits because of that, because the mood disturbances are bad, and you need to go to the doctor. You have depression and so on. The psychologists are there for you to work with you, to encourage you, and so on. This is a very difficult period, the first 3 months. And the insomnia is there. You cannot really sleep during the night. You're irritated during the day because you're very tired, anxiety, concentrating difficulties, restlessness, and so on. Okay. Withdrawal symptoms, we deal with it by giving these medications. We give the combination medication. We increase the dose depending on your addiction. And of course, you need to read a lot at home about habits, about addictions, about smoking, because that will help you, because your cortex is smarter than your primitive brain, and you can somehow shut this small primitive brain up a little bit. So please don't tell me anymore to smoke. And then remember the statistics that 75% of people are not successful within the 3 months. So if you manage 3 months, then you are really the hero here, because you are in the 25%. And if you manage 1 year, then you are really in the group of people that will manage to stay without any smoking during the whole life. The medications that we will use is divided here. We need to first talk with the doctor, and he will ask you something, he will advise you, he will assess you, he will assist you, and he will arrange follow-up visits. So we'll ask, advise, assess, assist, and arrange. Okay, and the ask stands for what kind of frequency do you have, how many cigarettes do you take, what products do you use, what degree of nicotine dependence do you have you tried to quit previously or not. The degree of nicotine dependence is dependent of age of smoking initiation. The frequency of how much you smoke is dependent on if you smoke within the first 30 minutes of awakening. It's dependent on your family and friends smoking also, and so on. The advice part stands for that the doctor talk with you at least 5 minutes at each visit, and the assess part will be to assess your readiness to smoke. And we can divide it into 5 stages. We have you're not ready, you have you're considering it, you have actively planning it, or you're taking action, or you maintain it, you say no. Okay. Medical therapy is in the group of assist. So assist stands for assisting with medical therapy, assisting with behavioral counseling, assisting with environmental optimization, and a quit date, as we talked about. And the medical therapy here is a patch, for example, and you leave it there for 24 hours, and this is the steady level that you reach. And it's very good to combine it with some oral preparations, and you give the highest dose if the patient is very dependent on smoking. And you keep it clean, so your skin needs to be clean and dry and hairless and so on, and then it works best. The most common side effect of these patches is only some itching, it's some irritation of the skin, and you just rotate it. Lozenges, this is oral medications. These have a doses of 2 to 4 milligrams usually, and you suck it until it dissolves in your mouth, and you take it maximally 1 time per hour maximally. Then the gum is 2 to 4 milligram also. You don't chew it vigorously, instead you chew it and you leave it in your gum, between your gum and your cheek, and then you can leave it there for about 20 minutes, and you will get the taste of some hot peppery taste. Okay, and the dose is here one per hour maximally. So this hot peppery taste is a sign that you're absorbing this medication. Nasal spray is the quickest one, as we said, the most rapid one, but the side effects, of course, here is that you get some irritation in your nose. That's it. So more than 8 times per day, but not more than 40 per day. 1 spray in each nostril. Don't sniff while you do this, and don't blow your nose within 3 minutes after spraying it. Inhaler, this is convenient because it feels like you're smoking, and this is convenient for most of the people. 1 time every 2 hours. Okay. How long do we give this medical treatment? We said up to 18 months if the patient is really severe, but usually otherwise 3 months is enough. Okay. The combination is the best one, and behavioral counseling is important to supplement medications. You have a quit date, and you have an environmental optimization. You have this arranged standing for follow-up visits by the doctor's office in the beginning every week, then you have every 3 months, and then you have every year. And that was this whole presentation about smoking. There are a lot more to say, But I would say these are the most important things to consider, and I hope that I have helped you a little bit. And please read books about it, look at other videos, and look at this video as many times as you want, and try to motivate you by considering all the risk factors that I've talked about, all the cancers and stuff, okay? COPD cancer. And look at my other videos talking about COPD, and then you will realize that you never want to be that patient who has COPD, because it's a really disgusting disease where you don't get any air, and people think that air is for free, but for these patients, it's a real struggle. They don't get any air. The most basic thing for a human being is air, and they don't get it. So if you continue smoke for more than 15 years, then you can be pretty sure that you will be that type of person who don't get air. You will be that kind of person who are impotent. You cannot get children. You are infertile, or if you're a woman, your fetus and your child will die, and so and the list goes on. Okay. Thank you very much for listening, and keep the persistence up.